What a great way to finish with a session very much round the patient at the centre of hip fracture care. We've kind of had it running as a theme all day, but this session is absolutely all about patient-centred care, and I'm delighted to invite Elizabeth and James, who are going to give the first presentation. So we've already alluded to My Hip, My Voice as a piece of work that we're doing within the registry. So I'll introduce Elizabeth. So many of you already know Elizabeth. So Elizabeth was our previous hip fracture registry manager in Australia, but she's actually a physio by background. She's also doing a PhD at UNSW, and actually her PhD is all about hip fracture care in resource-limited nations. So it'll be interesting to see the results of that, and I hope that you will be presenting at this in the future. Rather than get up and down like a yo-yo, I'll also introduce James. So James is relatively new to our team. At the registry, James is a nurse by background, a very experienced orthopaedic nurse who is passionate about the patient experience and has an awful lot of experience in terms of looking into how we can better facilitate listening to the patient and their voice. So I'm going to move and let Elizabeth and James tell you a little bit about My Hip, My Voice.
Thank you, Jackie. It's really good to be back face-to-face at a Hip Fest again, I have to say. To start, I'd like to acknowledge the consumers, patients and families whose lived experience is incredibly important to complementing the quantitative data that we've seen throughout today. And I'd also like to acknowledge the people of the Kulin Nation, the traditional custodians of the land on which we're meeting today, and I extend my acknowledgement to elders past, present and future. So most of you know about the registry, but a little bit of background to the first pilot project around consumer reporting of hip fracture data. The ANZ HFR is a clinical quality registry, binational, that collects data on hip fracture treatment to track care and outcomes over time. It publicly reports annually against the quality indicators found in the binational clinical care standard. And to date, the registry's reporting has been primarily to clinicians providing treatment and the hospital and health system more broadly. More recently, the Australian Department of Health has developed a National Clinical Quality Registry and Virtual Registry strategy. During consultation of the strategy in 2019, consumers were identified as an important stakeholder group for clinical quality registries in general. And it was found that registries really needed to tailor the information that they have to the needs of consumers. So we approached this project wanting to answer three questions. What is accessible data for consumers? That is, where do they go for information and when do they want that information? What is appropriate is really about what is important to them to know. And information being actionable is about consumers being able to use the information to participate in decisions about their care. So we set out to gather information on these three things to inform the development of a tool for reporting data collected by the ANZ HFR that was meaningful for consumers. The process that we've undergone this year is to do a literature review, a rapid scoping review of reviews. We were looking for evidence on formats and presentation of publicly reported health information, the aspects of that information that was considered important, and the effect of public reporting of quality information on patient outcomes, knowledge, engagement, behaviour or decision making. We identified 2,190 reviews, and after reviewing those title, abstract, full text, we've ended up including 31 reviews in that process. We also spoke to consumers. We had a focus group that was a triangulation of the patient, the advocate and a clinician, and that gave a really rich amount of data. We included semi-structured interviews with patients and consumers and advocates. And we also included some customer discovery conversations, which were informal approaches to understanding how older people access health information, where they access it, what makes information understood, and how they use the information. So those conversations were not specific to people with experience of hip fracture, but were just older people in general. What we found was a variety of perspectives, but one of the primary themes was access to consistent information at the point at which it was needed. So this has helped inform the tools that we're currently developing. Data and information being available at the hospital, as well as for family members who often go searching for information after they've visited their family member. The other theme that came up throughout a lot of the conversations was that it does sometimes feel like a production line. So how do we as clinicians help to maintain people's agency within a system where we're actually trying to reduce variation? So that's just a question that we need to work out how to do better for people. And the other thing perhaps reflects the way the Australian health system is structured. And sometimes people will feel like they're handballed from one professional to another for the same condition. And there's also a feeling that sometimes osteoporosis is not well understood for clinicians to provide recommended care around exercise, strength and balance. The overall findings were quite consistent between the review and the consumer consultation. Quantity and appropriate information at the time that it's needed. Formal and informal channels are used, so people talk to their networks. Trust in medical staff is also another important source of information. And when we're representing the hip fracture registry data, we need to look at telling a story, not just presenting numbers and text. Dr. Google was commonly used, and what people often want to see is data presented in a way that they can see themselves in that data. So that if I'm 60 years old with a hip fracture, that it's not so much about what happens to people who are 90, but to see someone like me at 60. So I'll ask you to watch this space with the hip fracture registry. We're looking to develop 3 tools, 3 different resources. One of those will be a consumer-specific dashboard, some carer resources and an update of the hip fracture care guide, and they will be available in 2023. So now I'll hand over to James to tell you more about the My Hip, My Voice patient experience.
And here we are, 2022. We have walked through the valley in the shadow of death, and we have survived COVID. And for the first time possibly in the world, we're going to be asking our patients and their families what they think of the care that we provide to them directly related to the repair of their fractured hip. I'd love to see that next slide because it's really moving, but in the meantime, let me read you a quote that came directly from one of your patients. It says, "The doctors and nurses, all the staff were so caring and wise," I like that one, "and skillful, and I was so grateful for the care that I received. They listened to me, which I believe is very important, as the patient knows their body and needs to be listened to." Now, this wasn't a quote made up from one of your patients. This was a quote that came from someone who had their hip repaired only in the last few weeks. And they had the hip repaired at a hospital in Australia, and this is the feedback that they directly gave us. I like it. It's the anticipation, really, that's the best part. I mean, we've waited all this time, haven't we? How long have we been fixing hips for? And this is the first time we're actually asking the patients what they think of it, right? And we're asking them to provide that information directly to us. We want them to tell us, did we do a good job? What did that job mean to them? Was it important to them? Because I, as a nurse, I know what I think is important to my patients. I think it's important that they get their hip fixed, right? But I think what's important to them is asking them what they think is important. And in fact, asking them questions like, did you wait too long for surgery, or was your surgery too quick? Why would someone think that having hip surgery too quick was important to them? Well, what if you felt rushed and you weren't provided with the kind of information that was important? So what we've done is, hopefully, we've asked our patients, and we've asked them with a series of questions that we put together over time. We met with clinicians, we met with families and patients, we met with the people working at the coalface, and we said to them, let's hear about your hip and your voice. You could try it out right now, if you like, to break this really uncomfortable silence that's now developed. And you can try out a piloted novel patient-reported experience measure that is being used for the first time ever to ask patients and families what they think about it. So firstly, I'd like to acknowledge the Indigenous people of the lands in which we're standing in today talking about this, but I'd also like to acknowledge the patients, the carers, the families and the loved ones for which we do this job and for no other reason. What are PREMs, or patient-reported experience measures, are really the patient's voice. They capture what it is that's important to patients and their families, and it reports it directly to us, the clinicians and the people that can make a difference. This is where we are on our journey. We started very similar to Pilot 1. We're doing some analysis and literature search, and we've just met ethics approval for our first site. So each of the sites across Australia will be governed and approved under ethics, and we're hoping that this will be embedded as business as usual. I don't want this to be a trial. I want this to be the way that we capture the voices of our patients and their families so they can tell us whether we're doing a good job and whether what we're doing is making a difference to their lives. And I think it's important because there is no other bigger stakeholder in the business of health than the person at the centre of that health. It's important for doctors and other medical providers to listen to the most important member of the team, that is the patient. So we've got 4 pilot sites, Western Australia and Victoria, New South Wales and Queensland. And those pilot sites have their ethics approval, and one of them has already started collecting data. Remember, we've got quite a challenging group of patients here to try and capture. They have, on average, an age of 82 years, and 37% of them have a pre-existing cognitive or known dementia. So, a challenging group of people for us to capture information on. But let's give you an example of what it's like. This is one of the questions that we take from our patient-reported experience measure. This is exactly what we're asking our patients and families. And the question is, my pain was well managed in the emergency department. Do I disagree or do I agree with that? My pain was well managed after my operation. Well, do I agree and do I disagree with that? And probably more importantly is the questions that have been selected for this pilot align with the quality statements so that the clinicians can take the answers and align them with a recognised quality statement and do something with it. Because without it, I mean, these are just questions for questions' sake. This is an example of Fiona Stanley's Go Live Pack, a site that's already started collecting patient-reported experience measures. I think Fiona Stanley deserves a brief round of applause, given that they are the first place absolutely in Australia and possibly the first in the world ever to do a patient-reported experience measure in hip fracture patients. And you know what? They started it by saying, what could we do better? Well, the thing that they think they can do better is they can ask their patients what they can do better. If you want to join and be part of this program, if you're interested, You can rip out your phone now and you can scan this more. Otherwise, the ANZ HFR My Hip, My Voice is the place to go to. Now, next time we're all standing in a room together, what you're going to be seeing is you're going to be seeing the answers from hundreds of patients. In fact, I'd like to be able to put up a graph this time next year that shows me 15,000 patient responses that tell you how you did your job in the last year. And I think there's nothing more important than putting the patient at the centre of that care. Thank you.